Everyone, in this class we'll study about circulatory shock. Circulatory shock is defined as inadequate tissue perfusion with a relative or absolute inadequacy of cardiac output. It is developed by cardiovascular dysfunction. There are different types of shock, can be classified as a hypovolemic shock, distributive shock, cardiogenic shock, and obstructive shock. Hypovolemic shock. It occurs because of the decrease in the blood volume. Here the amount of fluid in the vascular system is inadequate to fill it, and this results in decreased circulating blood volume. Important hemodynamic changes are there will be low cardiac output, there will be low central venous pressure, there is increased systemic resistance, that is peripheral resistance increases because of the vasoconstriction. Some of the clinical features which are due to the inadequate perfusion are cold, pale skin, cyanosed skin, oliguria, anuria, and intense thirst. Due to the sympathetic stimulation, there can be a rapid thready pulse, increased sweating, and hypotension. And due to metabolic acidosis, there can be rapid respiration, lactic acid accumulation, which occurs because of the increased anaerobic glycolysis, and alertness and restlessness. Hypovolemic shock is subdivided on the basis of cause. That is, it can be hemorrhagic, traumatic, surgical, and dehydration shock. Hemorrhagic shock, or it's also called as cold shock, most important cause for hypovolemic shock. The decline in blood volume produced by bleeding results in reduced venous return, and thus cardiac output falls. The heart rate is increased, and with severe hemorrhage, a fall in BP occurs always. With moderate hemorrhage, the pulse pressure is reduced, but the mean arterial pressure may be normal. Blood pressure changes may vary from individual to individual, even when exactly the same amount of blood is lost. The skin is cold and pale with a grayish tinge because of stasis in capillaries and a small amount of cyanosis. Here, the inadequate tissue perfusion leads to increased anaerobic glycolysis, resulting in lactic acidosis. Traumatic shock. It occurs due to the causing severe damage to muscle and bone. Profuse bleeding into injured area results in shock. Breakdown of skeletal muscles, that is rhabdomyolysis, is a serious additional problem where there is extensive skeletal muscle crushing, which is called as crush syndrome. In crush syndrome, myoglobin leaks into circulation, gets precipitated into renal tubules, and clogs them, resulting in renal damage leading to anuria. Surgical shock. This occurs as a result of external or internal blood loss caused by ruptured blood vessels, usually during surgical procedures. Dehydration shock. This occurs as a result of fluid loss from GIT, that is prolonged vomiting and diarrhea, and the disease of kidney like diabetes mellitus, diabetes insipidus. Fluid loss also occurs from the skin due to the burns, which is also called as burn shock, and which is characterized by hemoconcentration. In burn shock, the most important abnormality is loss of plasma as exudate from the burned surfaces. Here the plasma is lost rather than the whole blood, so hematocrit rises as a result, which is going to result in hemoconcentration. Then distributor shock, so which is also called as vasogenic shock or low resistance shock or warm shock. Here the blood supply to the tissue is inadequate due to the increased vascular capacity by extensive vasodilatation of the blood vessels, even though the blood volume is normal. The skin is not cold and clammy, hence it is called as warm shock. Some of the causes for vasodilatation are sudden loss of vasomotor tone, which can occur in neurogenic shock. Also occurs because of the in anaphylaxis, which is called as anaphylactic shock, and it also occurs in sepsis, which is called as septic shock. Neurogenic shock. Neurogenic shock is characterized by sudden depression of nervous system due to the loss of vasomotor tone, which leads to vasodilatation. It is common in ischemia of brain, general anesthesia, spinal anesthesia, and emotional conditions. Fainting or a syncope is a sudden and transient loss of consciousness and postural tone with a spontaneous recovery. It occurs due to the temporary inadequate cerebral blood flow. It is of different types. The vasovagal syncope, that is also occurs in emotional fainting, is also called neurocardiogenic syncope. It is due to the extreme activation of parasympathetic system, which leads to suppression of myocardium and severe vasodilatation. The cerebral blood flow also decreases. There is postural syncope, which is due to the pooling of the blood in lower limbs because of the prolonged standing. There can be micturition syncope, where fainting occurs during micturition is common in patients suffering from orthostatic hypotension. Significant decrease in blood pressure while standing is called as orthostatic hypotension. There can be effort syncope, which is common symptoms in patients with stenosis of sublunnar valves. These patients faint during exercise or any strain. It is due to the failure of heart due to increase in cardiac output when the tissues need more blood flow. Cough syncope. Sometimes severe cough increases the intrathoracic pressure, where reduces cardiac output leading to fainting. There can be carotid sinus syncope. It is common in patients wearing tight collar. The tight collar of the dress exerts pressure over the region of carotid sinus. This leads to reduction in heart rate, vasodilatation, and fainting. Anaphylactic shock. During anaphylaxis, there will be exaggerated allergic reaction to antigen. And shock occurs due to the release of histamine or histamine-like substances. These substances increases the capacity of vascular system by vasodilatation and by increasing the permeability of the capillaries. When capillary permeability increases, there is loss of proteins and water from the blood into the interstitial space, resulting in shock. Septic shock. Sepsis is the pathological condition caused by bacteria or toxic substances released by bacteria. It has both distributive and hypovolemic features. Endotoxin produced by some bacteria cause vasodilatation and increase the capillary permeability, which is going to lead to the loss of plasma in tissues. Coming to cardiogenic shock or congested shock, when the pumping function of the heart is impaired, the blood flow to the tissues is no longer adequate to meet the resting metabolic demands. The condition that results is called as cardiogenic shock. It is most commonly due to the extensive infarction of the left ventricle, but it can also be due to other diseases that severely compromise ventricular function. Certain chemicals released by ischemic tissues stimulate ventricular receptors and cause reflex inhibition of vasomotor center, producing bradycardia and hypotension, which is called as Bezold-Jarich reflex, making the shock worse. The symptoms are those of shock plus congestion of the lungs and viscera because of the heart fails to pump to put out all the venous blood return to it. So this occurs mainly in myocardial infarction, congestive heart failures, and in arrhythmias. Obstructive shock. Obstructive shock is due to the obstruction of blood flow. The conditions where obstructive shock occurs are pulmonary embolism, cardiac tumor, cardiac tamponade, that is bleeding into the pericardium with external pressure on the heart, and tension pneumothorax. Different stages of shock. Shock is divided into following three major stages: non-progressive or a compensated shock, progressive shock, or irreversible shock or refractory shock. Non-progressive shock. It is a stage from which the normal circulatory compensatory mechanism will eventually cause full recovery without help from outside therapy. Whereas progressive shock, in this stage, the shock becomes steadily worse until death. It is reversible with outside therapy, whereas irreversible shock, where the shock has progressed to such an extent that all forms of known therapy are inadequate to save the person's life. If not properly treated during second stage, the person goes into this stage. If it becomes severe, cardiovascular tissues deteriorate. Refractory shock is the manifestation of late effects of sympathetic vasoconstriction, long sustained decrease of regional circulation, and operation of positive feedback mechanisms. The main causes which precipitate refractory shock leading to death are: there is a cardiac failure and fall in the blood pressure and tachycardia, which leads to decreased coronary flow, myocardial depression, decreased cardiac output, decreases the heart rate, and decreases in coronary blood flow, and which leads to myocardial depression, which can act as a by positive feedback mechanism. Vasomotor failure during initial stages of shock. Vasomotor center is activated during the initial stage. If the abnormality is not corrected during the second stage, it will cause depression of the vasomotor center. Depression of the vasomotor center leads to decrease in vasomotor center activity. There will be fall in both systolic as well as diastolic, and the blood flow to the vasomotor center further decreases. That causes progressive reduction in the blood pressure. Finally, vasomotor center fails. The sluggish circulation, it leads to blockage of minute vessels. Blood supply to the tissues are affected. There will be accumulation of the lactic acid, carbonic acid, that leads to severe acidosis that depresses the activities of myocardium, vasomotor and other tissues, vasomotor center and the other tissues. Acute respiratory distress syndrome, which is seen in septic and severe hypovolemic shock. It is due to the hypoxic and accumulation of H+ ions. There is a damage to alveolar epithelium and endothelium and exudation of fluid into the interstitial space. Compensatory mechanism. It is divided into two groups, so it can be short-term mechanisms or long-term mechanisms. In short-term mechanisms, baroreceptor reflex, chemoreceptor reflex, CNS ischemic response, they play important role. Baroreceptor reflex we have already studied, and chemoreceptor, where there will be loss of blood, causes anemia and stagnant hypoxia. It stimulates the chemoreceptors reflex activities and activates vasomotor center, wherein CNS ischemic reflex, blood pressure less than 30 millimeter of mercury, it is directly going to stimulate the vasomotor center. Then there can be activation of renin-angiotensin system and formation of angiotensin II, which is going to be increased. Angiotensin II acts on subpharyngeal organ which contain an osmoreceptor that increases the thirst. Increased sympathetic activity, it leads to generalized vasoconstriction except in the brain and heart. In brain and heart, so there is vasodilatation because of the presence of beta-2 receptors. Venoconstriction, increased venous return, stroke volume increases and cardiac output increases. And the intense constriction of the splenic vessel lead to the redistribution of the blood to the vital organs, and increases in the activity of reticular activating system. These increases the muscle and thoracic pumping, which are going to increase the venous return, which increases the cardiac output, increases the blood pressure. Increased ACTH and aldosterone secretion causes salt and water retention and cause increase in the blood volume. In kidneys, there is a constriction of the efferent and afferent arterioles. GFR is decreased and prevents renal failure. So these are some of the short-term mechanisms. The long-term mechanisms are, they continues to act for hours to day, sometimes to weeks. So these include, there will be increase in the thirst for the salt, increase in the water absorption from the renal tubules and water absorption from the GIT, conservation of salt and water by kidneys mediated by hormones. After moderate hemorrhage, the circulating plasma volume is restored within 12 to 17 hours. And preformed albumin enters the circulation from the extravascular store to increase the extracellular fluid volume. Increased hepatic synthesis of albumin and other plasma proteins occurs in a period of 3 to 4 days. Increased formation of RBC, that is, formation of RBCs increases, reaches the peak in 10 days, and RBC content restored to normal level by 4 to 48 peaks. There is also increase in 2,3 DPG content shifts the oxygen dissociation curve to the right side. It decreases the affinity of hemoglobin for oxygen, so the more oxygen is released at the tissues. So these are some of the long-term mechanisms. Coming to the different types of shock and their causes, shock due to the decreased blood volume is caused by hemorrhagic shock, traumatic shock, surgical shock, shock because of the burn, and dehydration shock. Whereas shock due to the increased vascular capacity is caused by sudden loss of vasomotor tone, which is called as neurogenic shock, can occur in anaphylactic shock, and it can also happen in septic shock. Whereas shock due to the cardiac disease, which are caused by arrhythmias, myocardial ischemia, and congestive heart failure. Whereas shock due to the obstruction to the blood flow are caused by tumor in the myocardium, cardiac tamponade, and obstruction of the blood vessels in the lungs. Coming to treatment, immediate objective is to maintain and restore adequate tissue perfusion, that is blood flow. In anaphylactic shock, the drug of choice is epinephrine, which causes vasoconstriction. In septic shock, drug is antibiotic. In hemorrhagic shock, the blood transfusion is the mainstay of treatment. In burn shock, infusion of isotonic solution, that is normal solution, to compensate for the plasma loss. So this is in brief about shock. Thank you.